Hi, everyone. I'm Fred Childers. We are cutting into your regular programming to bring you Governor John Bel Edwards' news conference on the coronavirus and the state's effort to stop the spread. I see he's at the podium. Let's listen in.
All with the White House task force at 3 that it's a video telephone conference. I've got to go back to GOSEP for that. So we're going to try to keep this press conference a little bit on the brief side, briefer than normal. And before I get to the testing update, I did want to note that we had, unfortunately, some severe weather in the Acadiana region over the weekend, especially in the Church Point and Mammoth communities. Tragically, a 27-year-old lady died after high winds, which were likely a tornado that's still being investigated, struck her home. There were numerous other injuries reported in the region and some property damage as well. The National Weather Service is investigating the weather to determine whether it was, in fact, a tornado. And I can tell you that local emergency officials continue to conduct an initial damage assessment. So our prayers go to the family of the lady who was killed. Ask you to join me in praying for those who were injured as well. You know, this time of year we focus a lot on the start of hurricane season, which is officially June the 1st. And for good reason. But flooding, tornadoes, and other severe weather actually happens much more frequently and throughout the year. So it's important that we and our families are ready at all times for a variety of national weather events, natural, I should say, disaster and weather events. And certainly we're working at GOSEP to ensure that we as a state and the regions and the parishes are prepared, but we just want to make sure that families are doing what they need to do to prepare as well. So I again encourage everyone to go to getagameplan.org to learn more about preparedness. There you can download a copy of the Louisiana Emergency Preparedness Guide, and of course this time around you should include items like masks or facial coverings, hand sanitizer, and the like, given that COVID-19 will still be in the state of Louisiana during hurricane season. Getting back to the testing update, today we are reporting 277 new cases for a total of 34,709 that have been tested positive across the state of Louisiana since the inception of this public health emergency. We're also reporting 15 new deaths for a total of 2,440. And you can see that we are reporting an increased number of individuals recovered. That number is now 26,249. One of the hopeful trends that we're seeing over the last couple days is we haven't reported new death totals this low since the end of March. And we do obviously hope that that continues, because the most tragic outcome possible from this virus, this disease, is someone's death. And we mourn every single individual. And I know we report in numbers, but it never escapes my attention, and I hope it doesn't escape anybody's, that these are our brothers and sisters, our mothers, our fathers, and certainly we grieve each and every one of them. So it is a good thing that we're seeing the trend that we're seeing with respect to new deaths. We did have a small uptick in hospitalizations since, compared to yesterday. That brings us to 1,031 people hospitalized, and also a very small increase of people on ventilators, a total of 118. But if you go back over the last several days, both of those are down markedly. I also want to update you today on new information that's being made available regarding nursing homes starting today. As you know, our ultimate goal has always been to make sure that we have timely information to protect as many people as possible, especially those individuals who are most vulnerable to this disease, and just by definition, residents of nursing homes are, either because of their age or because of comorbid health conditions, and in many cases, both. Early on, we were reporting cases in nursing homes by name of the individual facility. That became increasingly difficult as cases increased. You might remember, in order to get information out as quickly as possible, there were times in press briefings we reported PUIs persons under investigation, I should say, who turned out to be negative, and they didn't have COVID. In many cases, a resident of a nursing home is tested and diagnosed with COVID-19, but not while they're in the nursing home. They're tested in a hospital or another outside provider. And that further makes it a little more difficult sometimes to report accurately. As we move from mitigation to suppression of the virus and we begin to slowly ease restrictions on the economy, we, as you know, are ramping up our contact tracing across the state. And I think this allows us to move to a new system of reporting as well, one that not only will be able to share individual names of nursing homes, not individual names of residents, but of nursing homes, but also other data points as well. And it follows recent CMS reporting requirements on nursing homes that start today. The department will share the following data for each certified adult care facility on its coronavirus webpage: the facility name and parish, the number of cumulative cases among residents, cumulative cases among staff, and the number of deaths among residents if they've had one or more deaths. This information is as complete and accurate as possible, and all information is from data reported directly by the facilities and will be updated once a week on Mondays. It's important to note that some facilities have implemented enhanced surveillance for COVID-19, including facility-wide testing, even of asymptomatic residents. Facilities implementing increased testing may report higher case counts due to enhanced case detection measures. Nursing homes are required to report positive COVID-19 cases to the Department of Health, and the department has been and continues working with each individual facility to increase testing of residents with and without symptoms, to minimize infection, and to prevent the spread of COVID-19. LDH issued formal guidance last Friday encouraging comprehensive testing of residents and staff, those with and without symptoms, in all congregate settings, nursing homes, incarceration settings, and so forth. In addition, the department is sharing aggregate totals for other adult residential facilities which are not certified, such as group homes and addiction facilities. This information will be shared on Mondays through a department news release. I can also announce today that a crisis text line has been activated to provide free, confidential, 24/7 support for individuals across the state of Louisiana. So if you need to talk to someone, you can get connected by texting REACH OUT. Now this is all caps, REACHOUT, REACH OUT to 741-741 to reach a trained crisis counselor who will help de-escalate, identify coping strategies, and use active listening techniques to support you. This is one more way that we're working to provide resources for anyone who may be experiencing stress, anxiety, or a mental health crisis. So once again, you can text REACH OUT, all caps, to 741-741. This support is being provided by the state of Louisiana's crisis counseling program for COVID-19. On that note, I do want to encourage everyone to take care of yourselves. In addition to the preventative measures you hear me talk about every day, hand washing, mask wearing, social distancing, make sure that you're also keeping up with your physical and mental well-being. It's always okay to ask for help. Because we have a tighter time frame today, we're going to forego the questions from the public, and we'll turn straight to a few questions from the media. And before I forget, on Wednesday I have my monthly radio program, so as of right now we do not anticipate having a press conference on Wednesday. If that changes, we will let you know. The next time we anticipate having one of these will be Friday afternoon, I think at 2:30. So with that, we'll get to your questions if you have some. Yes, ma'am, Melinda.
Doctor, there was a piece of information in the LDH statement today that talked about outbreaks at 3 work sites somewhere in the Acadiana area. Can you talk about what work sites those are and what the numbers are?
Yeah, I'm going to ask Dr. B to do that. It's some testing that we've done in some congregate settings with respect to migrant workers. Principally, I think the ones you're referring to are in crawfish production facilities, but I'm going to ask Dr. B to come up and give you that information.
Yes, sir, that's right. So we have initially found there was one outbreak in a group of workers who work on a crawfish farm and live, I think, in dormitory-like settings. That led to broader testing, a number of persons under investigation, people who are not symptomatic being kept separately from the people who were actually COVID positive, and then a subsequent 2 work settings that were also found to have cases. Those are still under investigation. We're still gathering more information, and I think we can follow up with you offline with more information on the locations. But we're currently working with those groups to find out exactly how many people are in those facilities, make sure that there's adequate testing, so that we understand the sort of the scope of those clusters.
So are they all crawfish farms?
My understanding is they are.
So 3 crawfish farms, how many people have tested positive throughout the 3?
So we can follow up with that information afterwards.
And are they all migrant workers, or is it a mix of migrant workers and local residents? What kind of communities are we talking about?
So I know at least some are migrant workers, but we'd have to follow up with more specifics for you afterwards.
And all 3 of these are in the Acadiana region?
That's my understanding.
Thank you, Alex. Yes, sir.
Governor, there's some important bills moving through various processes of the legislature today concerning relief, tax relief for oil and gas industry, as well as coastal lawsuit relief. And there's also a tax relief bill that would suspend corporate taxes. What are your opinions on these moving forward?
Well, first of all, obviously when you have economic downturn like we've had over the last couple of months because of COVID-19, you want to do everything that's reasonable to help. At the same time, you have to pass a responsible budget, and you cannot include in your budget revenues that you don't have, and you don't have them if you've given them away. And you know that we had an REC forecast for next year where the forecast was reduced by some $900 or so million. And so that's a very difficult situation. And in order to make sure that we can adequately support hospitals, for example, which anytime you have well, first of all, I don't think it's ever a good idea to have wholesale cuts to health care, but you certainly don't want to do it when you have a public health emergency, a pandemic like we're currently experienced. And if anything, you want to be supporting your providers and make sure that they are able to deliver care, to manage disease, get people in the best possible health, but also to be prepared and we, in case we have another iteration or resurgence of COVID in the fall. And it's not like it's going to go away between now and then, but we are being told that we should perhaps anticipate, but at least prepare for another iteration in the fall. So we want to be as responsible as we can. And for those reasons, I don't believe that those resolutions at this point are responsible. Yes, sir.
How would you characterize the proposal for the budget that you've given lawmakers so far?
Responsible, prudent, one that takes full advantage of the help that's been provided by Congress in the CARES Act in the various iterations. I think there have been 3 of those now, both as it relates to the CARES Act funding, but also as it relates to the FMAP enhancement that was made retroactive to January of this year, and that we will believe will run through at least September the 30th of this year, perhaps longer. And that's where the federal government assumes a bigger portion of the costs associated with the Medicaid program. But it's one that is responsible. There will still be cuts, as you all know. Basically, there will be 2% cuts to most state agencies, including my office, the Division of Administration, but also to the judiciary, to the legislature, various statewide elected officials. There will be about $80 million in cuts, including significant cuts to the Department of Health, but they won't include Medicaid or optional services. So it's one that I believe is responsible and it's prudent. and it's about the best I think you can do under the circumstances given the REC forecast that we got on Monday of last week. Yes, sir.
Governor, what was kind of the deciding factor in adding the number of cases of COVID-19 in the nursing homes again? And when do you think it's going to be safe for people to be able to visit their families in the nursing homes again?
Yeah, well, first of all, I don't know the answer to the second question. I know that we were one of the first states in the nation to stop visitation to nursing homes, to hospitals, to prisons and jails, because we didn't want the virus introduced into those congregate settings where spread is more easily, well, obviously those settings are more conducive to the spread, but also you have individuals, especially in nursing homes, that are more vulnerable to it. So when we can relax those restrictions, I'm not sure, and maybe Dr. B, you have something to add on this, and I don't believe that the federal government through the CDC has recommended that we relax those rules yet. Again, there's still a lot of COVID-19 out there. And so, but we started off trying to provide that level of information. It just became very difficult over time to do it. Now that we are moving from one phase of our response to COVID-19 to the next, we believe that we can, in a very accurate way, once a week provide this information. And we've been asked to do it on a number of occasions, I think by the advocate and by some others as well. And so we wanted to get to this point. The other thing is we know that the nursing homes are going to start reporting this information directly to the CDC, or I should say directly to CMS, and then they will report it to the CDC as well. Yes, sir.
Can you talk about what your guidance is to businesses regarding whether they should require customers to wear masks when they come into business? It appeared to me like the original guidance you crafted included you should require customers wear masks, but that's no longer the latest version.
No, I don't believe we've ever said that a business should require, and I'm not requiring in terms of it being part of the order that people wear a mask when they're out of their home in public, whether they're indoors or outdoors. But it is strongly encouraged. We believe it's the responsible thing to do, so that we can protect one another out there and minimize the spread of COVID-19. But it is strongly encouraged. It is not required, and we have not told business owners that they should require it. Business owners obviously are in control of private property. They can set those rules as they see fit. And I think you have some certain businesses that are doing that, and most are not. But it's not something that we've required, and we're not telling businesses that they should require it. But we are telling members of the public that you should do it. It's a CDC recommendation. It's an LDH recommendation. We know that when you wear the mask, the virus isn't going to travel as far when you speak, if you happen to cough and so forth, and so you can really cut down on the spread of the virus. And again, when you wear that mask, you're protecting others from yourself, and when they wear masks, they're protecting you from them. And just being good neighbors means that we should do that. And it's really not that bad of a thing to do. I mean, I'm looking at you all. You look great with your masks on. I know how much you enjoy wearing them. But when you think about the good it's doing for people to wear them, it's not much of an inconvenience. It's not much of a price to pay. If this is how we keep cases down, even as we re-engage different businesses and bring more people to work and bring more customers back into stores and restaurants and so forth. Yes, sir, Leo?
Governor, I've seen nationwide an increasing number of stories about businesses, municipalities, and state governments are afraid of lawsuits as a result of their decisions made with regard to reopening. Is there any possible way to shield the state? The state paid out $50 million in lawsuits just 2 years ago, mostly traffic related. I just wondered if there was some way to shield the state.
You know, I don't know. It's not something that I lay awake at night worried about. This lawsuits against the state. We're trying to make the best decisions we can make based on the information we have. based on science, based on epidemiologists and doctors and experts, but also obviously talking to economists and the business community about what we can do to safely reopen, looking at the plan given to us by the President and that had been vetted by the CDC as well. So I really don't focus on litigation or potential litigation. I'm not aware of a lot of litigation that's been filed. I know that there was the one case that I think the federal judge decided on the TRO and the injunction last Friday, the Reverend Spell, and decided that in the state's favor. I'm not sure of other litigation that's out there. It's just not something that I worry about. I'm trying to do the best job that I can, making the best decisions for our state, and I understand that there will be some people who disagree and second guess and so forth. The vast majority of that, I suspect, won't rise to the level of a lawsuit, but some of it may, and we'll just deal with that when it comes.
One of the stories that I did see, they said contact tracing could actually be used as part of a lawsuit.
Yeah, you know, and I'm not sure why that would be. We've done contact tracing for decades in the country and here in Louisiana, and we're not going to do it in a way that breaches confidence. We're not going to be sharing information, and I would think the overwhelming majority of people who have been exposed to someone with COVID-19 would want to know about that. And then the overwhelming majority of people who receive that information are going to do the right thing. And so I guess it's always possible to find someone out there who for some reason takes exception to it, but we know it's responsible, we know that it works, and we know that if we want to regain some sense of normalcy, not normalcy, but some sense of it before a vaccine, this is the only way you can do it. You've got to enhance your testing, you've got to enhance your contact tracing, and then you need people to act reasonably and responsibly when they get that information that they've come into contact with someone who's got COVID-19. Yes, ma'am?
Showing how many nursing homes have clusters. Is that new data alarming?
Well, you know, obviously, anytime you see COVID-19 in a congregate setting, it is alarming. When you see it in a nursing home, where you know that the people there, by definition, are vulnerable because of their age, because of comorbidity, and in most cases because of both. So obviously, it's one of the things that you concerned about, and that's why the Department of Health has been working so hard to form strike teams in every region. We've done 100% testing in a number of nursing homes, and that's going to continue as we move forward. We're in there making sure that we're providing good guidance on how to clean and stop the spread and infection, how to isolate once someone becomes COVID-19 positive, and how to reverse isolate in advance of that in case you have people who are more vulnerable. And what you see in Louisiana, I don't believe, is terribly different from what you're seeing in many other states. And what we have to recognize is that this virus seeded all across the state of Louisiana before we ever knew it was here. And it travels, and this is the point behind the mask that you're wearing, by the way. It travels in ways that are very, very hard to stop, because people will be totally asymptomatic, but they will have COVID-19, they will be contagious, and they might be a worker in a nursing home. There could be anybody, but that's one of the things that make this really challenging, which is why we're testing staff, we're testing residents, and we're testing staff and residents who are asymptomatic, because we know that that's incredibly important. And I will tell you, there's been a lot of really, really hard work, good work, but it is still the case that we have COVID-19 in a number of our nursing homes. And I will tell you, many of them have been able to stabilize the situation because of the hard work that they've done. And so I appreciate their work. But the short answer is yes. COVID-19 concerns me, period. And it especially concerns me when it affects people who are more vulnerable in those congregate settings. And so nursing homes check all the boxes. Very, very concerning.
Last one?
Yes, sir.
Governor, I know we just made it to phase 1. How and when will you make a decision if we're ready to phase 2 by the start of June? I believe June 5th. And are you optimistic on it at this point?
Well, I'm optimistic, but I know that we have to look at the data. And so as we announced, the current order for phase 1 goes through June the 5th. That's a Friday. I anticipate that we're going to be collecting data over the next couple of weeks, the 14 days, and then we will analyze that data and try to figure out whether we meet the criteria for moving forward into phase 2, which would be a further easing of restrictions. And you make it based on the same sort of analysis that you did the first time to go into phase 1. You look at COVID-like symptoms being reported to emergency rooms across the state of Louisiana. The COVID cases, both the raw number, but more importantly, the cases as a percentage of tests that are being administered across the state of Louisiana. And then you look at hospitalizations. And you take into account all of that information. You look at how much you've been able to ramp up your testing capacity and what you think that's going to do in the future as well, and your contact tracing ability, and then you make that decision. The timeline that we've set forth is to get the data over the next 2 weeks, to potentially make an announcement as early as Monday, June the 1st, as to what people can expect on June the 5th, so that they can start getting ready for that, businesses can prepare, and so forth. But I am not making that announcement today because we don't have that data. And one of the common questions that I've gotten is, if the president's plan calls for 14 days of data, why didn't you make phase 2 potentially happen 14 days after phase 1? Because you cannot collect data real time, analyze it, break it out by region and by parish, and look at it every way that you need to look at it, and make a decision all in the same 14 days. And so it does require that amount of time, and I think that additional 7-day period not only allows for a better decision, it allows you more time to communicate that decision and prepare people for what phase 2 looks like. Obviously, we hope we get to phase 2 on June the 5th. We can't make that commitment until we see what the data does. But what I can tell you, if the people of Louisiana will continue to social distance, wear their masks, engage in good hygiene, then there's no reason why we can't continue to see improvements in our cases, even as we open up more businesses and houses of worship to more people and so forth. But this gets back to the main point we've been making all along, and that is there's a role for everyone to play. And that remains true, and it's as true now as it ever was with respect to how people should be conducting themselves during phase 1. And for people who are vulnerable, we've been talking about them, but we've been talking about them primarily in the nursing home context. But for people who are 65 or older, or people who have these underlying chronic comorbid health conditions, hypertension, diabetes, kidney disease, heart disease, obesity, nothing really should be changing for those folks. They need to know they're safer at home, and they should stay at home unless it's absolutely essential that they get out and about. And so if the people of Louisiana will do this, then I'm confident that we're going to continue to make progress. But we will be watching the cases just very, very carefully to make sure that we can, in fact, move forward. And when we have an announcement on that, which I suspect it's a couple of weeks away, then that's when we'll be making the announcement. Again, right now we don't plan to have one of these press conferences on Wednesday. We do plan to be back with you on Friday. If something happens between now and then and we need to get together, we will certainly put out a notice. But thank all of you for continuing to cover this public health emergency and everything else that's happening across the state of Louisiana and here in this Capitol building during the legislative session. We'll see you on Friday.
All right, there you have it. Governor John Bel Edwards with a rather brief news conference this time, as he has another engagement. So we'll follow along in that vein and have a rather brief recap. So 277 new cases in Louisiana. That brings the total to 34,700 9 cases of coronavirus in Louisiana. Unfortunately, we've also seen 15 new deaths today. That brings Louisiana's death toll to 2,440. Governor Edwards also talked about the state's effort to ramp up contact tracing. Now, he specifically mentioned the very vulnerable nursing homes. He says these facility names will be shared as part of the information sharing during the contact tracing, and he believes that this is very important information. Obviously, it helps the state to understand who has had COVID-19 and who is at risk of getting COVID-19. He reminded people of the state to keep up with not only your physical health, but your mental health as well. If you need help, ask for it. He also mentioned, well, actually he was asked about the state's budget. That's something that lawmakers are dealing with right now in committee rooms down at the Capitol. There is a lot less revenue for them to work with this time around for obvious reasons. So the governor mentioned $80 million in cuts in the state's budget, and that will befall on many departments. Actually, Harrison Golden is down there as well. He'll have more on that for you later tonight. So for the very latest, be sure to download our BR Proud app, and we will see you back here on Local 33 News at 5 and 6 and at 5:30 on Fox 44. I'm Fred Childers. We will now return you to your regular programming.